remedial work, if you like, of the day, which will be looking at the tools that we've included in the manual to help you self-assess. So this presentation is going to revisit the concept of self-assessment very, very quickly, because you could talk all day about self-assessment. Consider what self-assessment involves, and then discuss the process that you will be undertaking. So what's self-assessment? It's a process of measuring your practice against clearly defined criteria and outcomes. And in this case, what you're going to be measuring and benchmarking your practice against are the revalidation criteria developed by the GOsC. Clear as mud, isn't it? So it's basically just about looking at what you do, looking at the revalidation criteria, and then assessing how you can provide evidence of that. And we'll work through that process in a minute. What you need to self-assess, the first thing you need, and I think it's a good idea to spend a couple of minutes just thinking about this before you start using the self-assessment tool that we're going to ask you to use. First thing you need is a clear understanding of what your osteopathic practice actually involves. So, you know, where do you work? Who do you work with? What type of patients do you see? What sort of age group? What are the common conditions you look at? You know, what's the sort of environment that you're working in? All these sorts of things. So take a couple of minutes at the start of this exercise just to jot down the key points about your practice that you think are important, that you want to reflect within your supporting evidence.
Could we just say, as soon as you say conditions, it is a problem in a room of osteopaths because we don't treat conditions.
Did I say conditions?
Yeah.
I apologise.
Thank you, Katrina.
Some words just trip off my tongue, and if I use medical terminology, then just
ignore it.
Transfer it into osteopathic speak. So you need familiarity with the GOsC osteopathic practice standards and revalidation criteria. You have them all in your manual, and you will find that as you keep, referring to them, they will become much more. You'll become more au fait with them. And the ability, and this is the most important thing, is the ability to be honest about what it is that you actually do. So you need to, if you're self-assessing, you're self-reflecting, you need to be almost able to step outside yourself and say, this is what I actually do. If I was looking in at me, this is what I do as an osteopath.
Excuse me,
Yeah.
I'm already a little bit lost between 1 and 3. I can't grasp in my mind what I need to understand. A clear understanding of what osteopathic practice regularly involves. I can't grasp that.
Just what you do on a day-to-day routine basis as an osteopath. What do you do? When you go into your clinic in the morning, what do you do? Is it a clinic? I don't know, but
well, in which form?
I
I manage the staff. I put the PC on. I treat the patients. I do the. I mean, what are you actually after here?
I'm not after anything. This is your self-assessment, and that's asking you to step back, look at yourself, and say, what do I actually do in osteopathic practice? What you've
all
actually...
the processes engaged in running the clinic.
No, just what you... Yeah, that might be what you go on to examine later on in the self-assessment. But initially, this was a have a look at what you do.
Could you give me a for example, because I'm not on the right track.
For example, right, I'm not an osteopath. This is going to be difficult, isn't it? Okay. Just ignore all the, if I make mistakes and faux pas, just ignore it. This is me just pretending to be an osteopath for the day. Okay. Right, so I work as a sole trader in Perth. I'm the only osteopath within a 50-mile radius. I regularly see mostly elderly patients with back pain and knee pain, but occasionally I get young children and adults in with young children and adults get something. So those are the types of patient I see. I have a good relationship with the local health centres and the GPs, so I refer patients on quite regularly, and they respond to my letter very quickly. So all those sorts of things are the sorts of things that I do on a daily basis. I manage, what do I manage?
An associate. An associate.
An associate, yeah, I've got an associate.
Katrina, what you're doing is you seem to be describing your profile.
Well,
You're
that's...
describing yourself in terms of...
I would have assessed whether I do structural osteopathy, cranial osteopathy, visible osteopathy.
Well, if that's important to you, that's what you put down. That's absolutely fine. It's your self-assessment. I don't know enough. I'm going to give an example. I don't know enough to do that, but in your self-assessment, that's obviously a very important aspect of your osteopathic practice, so that might be the first thing you put down. That's fine, that's okay. Does that help?
So it can be anything from the geography, the demographic, the technique, the answering the phone, the managing the 26 people who work in your multidisciplinary clinic, to driving about and looking at horses on an individual basis. So any of that old stuff.
I'm not quite sure about the horses, but yeah. Yeah.
It's allowable under the osteopathic.
Okay. Absolutely fine. If that's what you do, then that's fine.
And so that answers point one, does it?
Yeah. I mean, it's for you. It's not for me. So it's for you to have an understanding. And sometimes if you write things down, you get a better understanding.
Yeah.
So does that help you?
Thank you very much.
Yeah.
We could spend, I mean, I could spend the whole of the 30 hours just doing that, writing that down.
You
Because
could.
it's so varied. My day is so varied. And when you say clear, it would be really clear if I spent 30 hours writing about it. But if I just spent 3 minutes, it would not really give any clarity about.
But you
what
obviously
my
don't need to
understanding
write it
is.
down because you know in your head what you're doing.
People not know what they're doing.
Well, some people, actually, when some people stand back and look at what they do, they're surprised. You know, so it is just to get a feeling for what it is you do and an understanding of what you do. And nobody's saying it needs to be written down or documented. I'm just saying that you need to have it. Okay? All right with this slide? Right, the process, and this is just to, again, to help you work your way through this. As I said, it's a good idea to think about your current practice before you start completing the self-assessment tool. And SAT stands for self-assessment tool. Now, in your pack, you will have a green, you will actually have a self-assessment tool template.
Green?
Green.
Colourblind people for us.
Well, it's kind of,
No, that's a good point.
it's kind of
We'll collect that in the
this one. That one there?
What page is that? Sorry.
You have it in your pack.
Gotcha.
Yeah, have it in your pack. And this was actually just developed to help you actually self-assess. It's a draft tool. Would be interested. There was some discussion at the back there about whether things were bespoke or not. This is bespoke in that the revalidation criteria for osteopaths have been fitted into it, but it's not bespoke in that it's a tool that's been used by other professions to self-assess. So it's a tool that's been sort of adapted for your use in the hope that it will help you. Again, we'll be interested in feedback on whether you find it does help you or not. So what you need to do is look at the questions posed by the self-assessment tool in relation to the 4 themes of osteopathic practice. Okay? So in your self-assessment tool, you'll find the 4 themes on one side. In the middle, you'll find the revalidation criteria. And then in this bit here, you will find a green, amber and red column. That's just to help you. What you should do is just go through the self-assessment tool very quickly. And if you think that it would be easy to provide evidence to support your practice in any of these areas, then you tick it as green. If you think, yes, I do that, but I'm not quite sure about how I can evidence it, you tick amber. And if you look at a question or a criteria and think, oh my God, I haven't a clue, I don't know I do that, but I have no idea how I'm going to evidence it, then it's red. Does that make sense? So go through all the questions, just tick them in relation to your own osteopathic practice, and we'll be doing this in a minute. Then you need to think about, okay, I've ticked green, I've ticked amber, I've ticked red. If I've ticked green, what can I do to actually support that? So if I've ticked, for example, that 1.3, I gain informed consent, then what sort of evidence can I produce to go through that? You know? So it might be an informed consent form, it might be the fact that you ask your patient verbally, you know, what do you do in order to gain informed consent?
But how would you get evidence that you asked them verbally?
Yeah, that's what we'll come to.
A lot of this is verbal.
And body language and
Yeah, well,
rapport.
you can. There's a number of ways you could ask your patient whether you've asked them. You know, we'll consider the evidence as we're going round. So where you feel that you can provide evidence, make a note of what your evidence might be, and you might feel, yes, I do gain informed consent, thereby I do it verbally. So your tick for that particular one might be amber as opposed to green or red. Where you feel you might need to do further work before you provide evidence, then you might want to start thinking about an action plan, and we'll come on to action plans this afternoon. And we'll be, oh no, it's later on this morning, isn't it? The days are all rolling into one. Okay. So just that's the actual process that you're going to be going through. Don't worry about it, because while you're doing the exercise, we will be circulating around the tables and talking things through for you. What I want you to do now is just do what I said. Take the self-assessment tool, work your way through it. You've also got a sheet. Can I just finish this? We've also handed out something here, because when we did the first workshop, people were really struggling about, what might I include as evidence section when they did the self-assessment tool. So you have as well on your table a little sort of summary of the types of evidence that you might like to look at and what they actually involve. We'll be looking at the evidence in more detail this afternoon, but we thought that you might find this useful for this exercise as well. Okay? So you can refer to those, and it also tells you which page of the manual if you want to go to something and get a bit more clarity about it.